the inadequate dietary intake, but we are also have to think about the basic consequences or basic causes, yeah, for these issues. So there are a lot of contributing factors that stunting, yeah, overcome in the community. The direct and indirect causes of stunting must be addressed jointly by the relevant cross-sector when we are talking about the socio-cultural aspect, economical aspect, political aspect. I think in many countries, we have a lot of experience about these issues. Yeah, working with the many sector to tackling one issues that all of the sector have contribute to that issues. Integration and convergence of the program implemented across the sector will result a greater leverage in effort to reduce stunting prevalence. Based on this framework, we have what we call national strategy. But before that, I will show you the framework of action to achieve the optimum fetal and child nutrition and development. As we know that, as I mentioned previously, sensitive intervention are activities related to indirect cause of the stunting, which are generally outside of the health issues. Talking about the health issues with another sector, from the health personnel, it is not easy, yeah, because sometimes we just only talking about the technical aspect, but in the other hand, we need other sector, other participant understanding about the issues, and that's why they will be share the resources for that. As I mentioned, that we are working at the nutrition sensitive and talking with the agriculture and food security, social safety net, early child development, maternal mental health, women empowerment, child protection, classroom education, water and sanitation, health and family planning services. But in another hand, we also will be tackling the building environment, the enabling environment, yeah, such as talking to advocate another sector, and also horizontal and vertical coordination. Yeah. When we are talking about that one, now we are talking about the communication, talking about the how to raise the issues, who are all of the sector can be have attention and also will be participate to our activities. That is the challenge, and also that is the real challenge, because based on the Blake et al. 2013, that sensitive program will be contribute at least 70% of the stunting in the all of the country, yeah, and also will be have of the specific activities. It's not talking about the health only. Yeah. So based on that, yeah, Indonesia already have a stunting intervention concept. And if you look at the situation of stunting in Indonesia, based on...
Excuse me, Dr. Anung.
Yep.
Could you please to make it a slideshow? Because
okay.
Yeah, I apologize to
yeah.
interrupt you. Thank you.
Yeah, like this one, yeah, Pak Andri. It's a bigger one.
Yes, thank you very much.
Yeah, If you look the situation of the stunting in Indonesia based on basic research survey 2013 and 2018, that we looked at in the several of the province. As you know, that Indonesia have 34 province and more than 500 district level, more than 100,000 village and village level. So we looked at this is the situation of the stunting in Indonesia. Even we know that in the several different. Even we know that the situation started from 27 until now. It's still decline, but the prevalence is very high. Almost one third, under 5 years are stunted in Indonesia, and we have 2 provinces with the very high stunting prevalence. This province, and East Nusa Tenggara and also West Sulawesi. And then we have only 1 province with the prevalence under 20%. 23 provinces have stunted with the prevalence 20 until 30%, and 18 provinces with the stunted prevalence 13 until 14%. This is the challenge. If you look at the number, as you know that in Indonesia, in every year, we have 4.5 million the new baby. We have 5.2 pregnant women in every year, and 4.5 million delivered in every year. If we are talking about 1/3, that just means more than 1.5 million. Even the situation in each country, in each province is different, but that is the real situation. 1.5, it's more than one population in one country, maybe in Africa or in another country in the world. As I mentioned before, that we already have national strategy for preventing stunting based on the Blake et al. In the publication, UNICEF and another publication. We set up 5 pillars as pillars of the stunting prevention, such as leadership commitment and vision, national campaign for behavior change, convergence of the central, subnational, and village program, food and nutrition security, and then monitoring and evaluation as a part of the implementation of the governance. And as I mentioned, that we have 2 intervention, specific and sensitive intervention, and we have to deliver all of the sensitive intervention into the almost 18 line ministry in Indonesia to tackling sensitive aspect of the stunting. And the impact of the national strategy is to decline the stunting prevalence, but output, we already set up 4 output. Nutritional consumption hopefully will be increased, and then parenting, and the third one is health services, and the environmental health as what we call backbone of the sensitive approach. These efforts are directed to improving nutritional consumption and reducing the incidence of infection. That is a national strategy for stunting prevention. And then when we are talking in detail, the sensitive intervention, we are already set up the target and also the activities in detail. One, increasing access for the nutritious food. That is not only talking about the food itself, but we are also talking how the family will have food supply and surround of the household. The second one, increasing the awareness, commitment, and practice of the maternal and child nutrition care. As you know, based on the risk test also or basic health survey, we understanding that almost 20 until 25% of the pregnant women actually she or he or his family don't want that pregnant due to the access of family planning, due to the another reason. So increase awareness, commitment, and practice of maternal and child nutrition care. It's very, very important to improve the capacity of parenting in the household. The third one, improve the access and quality of nutrition and health services. And the fourth one, increasing the provision of the clean water and facility sanitation. In Indonesia, we have almost 15 until 13.5% of the household without any facilities of sanitation such as latrine and clean water. That is also the challenge due to the situation of the what we call the natural situation, but also the other situation such as poverty. And monitoring evaluation also very important because we are not working alone. We are working with all of the sectors, and then at that situation, we have to make it accountability, transparency, and also to share the knowledge and accelerating learning between one and another district or one and another community situation. To ensure the sustainability, this result-based monitoring and evaluation system is necessarily receive constant attention, resources and support, and political commitment. That is related also with the election in the village level, district level, provincial level, and also the national level. That's why monitoring and evaluation as a part of our pillars of the activities of tackling the stunting, to prevent the stunting in Indonesia is very important. To the aim of the improved monitoring and evaluation as a basis for ensure the quality of service delivery, increasing accountability, and accelerate learning. As I mentioned, monitoring and evaluation focus on impact and outcome program, key output, and factors that support the acceleration of prevention stunting. This figure shows that there are a lot of line ministry such as Ministry of Education, Ministry of Public Work, Ministry of Industry, Ministry of Agriculture, Ministry of Social, Ministry of Family Planning and Welfare, yeah. Ministry of Religion, Ministry of Fisheries, yeah. Also the Ministry of Women Empowerment and Child Protection. That is a part of our team in Indonesia as a team for preventing and reducing the stunting. There are a lot of activities that I will be show and discuss with you in the activities of sensitive intervention, but I'm also will be share the challenge to implementing sensitive approach, yeah, for preventing and tackling the stunting. There is several activities in each district, yeah, that we have in West Sumatra, we have in Central East Java province, we have in another activities, yeah, but we also understanding that the Ministry of Village and Disadvantaged Region are already integrated the program in the village level into the SDGs indicator. As we know that the indicator number 3, when we are talking SDGs, is related to health, yeah, and another indicator of SDG are related also to the sensitive activities to tackling the stunting, such as water sanitation, clean water and sanitation, and others. Yeah. This also we have the construction of the clean water facilities and family latrines in NTB and West Nusa Tenggara and also Lampung, as I mentioned. That is created by the local leader and support by the budget come from the national level, from the Ministry of Village and Disadvantaged. And then we also have two housing construction or rehabilitation and integrated Ada yang terganggu, Pak?
No, tidak ada, Pak. Silakan dilanjutkan.
Oh, saya pikir tadi ada yang terganggu. Okay. So, housing for construction of tuberculosis, as I mentioned before, that the infection of the tuberculosis is also high in Central Java and East Java and West Java. Yeah, the prevalence of tuberculosis, HIV also high. And when we are looking in detail, one of the causes of the tuberculosis is related also with the poverty and house construction, such as ventilation, clean water, and others. And I will be show you in the next slide, maybe talking in detail about the integration of the school health effort in changing the behavior of the school children as a prospective mother in West Java. That is one of activities who are already shared also in the other province, yeah, and are already adapted by some of the province to that activities, because talking about the stunting is not only talking about the under 5, but we also have a specific intervention with the other prospective mothers, such as like this one, yeah. And you know that why we choose school health effort, because almost 100% of the school age, yeah, are already in the elementary school in Indonesia. So that is also why we are talking about the school health effort as a part of the sensitive intervention. The provision of the community companion cadre for the East Java families, provision by household, scale, food stuff, almost in most intervention areas. So in East Java, headed by the Ibu Gubernur, wife of the governor at that time, they put it 1 or 2 or 5 or 10 cadres, to accompany the pregnant woman day by day, and then train what we call the parenting issues, and also as a part of the improving the health services for the pregnant woman. This is the activities in West Java that school health program or school health effort as a part of the specific sensitive intervention. We intervention of the school canteen to train the food handler, establish and strengthen the healthy school canteen, and also food contaminant analysis. As we aware that food security is also a part when we are talking about that issue of the stunting. And then we in Indonesia, fortunately, that almost all of the school have a garden. It's enough to make it the nutrition literacy. So we are working with the Ministry of Agriculture. We are working with another resources to plant some of the local food, in the school garden, and then to make it understanding about the nutrition, hygiene, sanitation at school, hand washing, and then also no smoking area in the school, environmental health analysis, occupational health for school teachers and personnel also as a part of that, and then nutrition education based on the local food. At that time I'm have a chance to visit West Java and also have a chance to visit East Nusa Tenggara to understanding how the cadres and also health personnel train the mothers to understanding about the food, and also to plan the resources of that food in that area and others. Physical activity and nutrition and entrepreneurship, especially in the senior high school. In Central Java, we also have vocational school, and then they plan, some of them as a what we call some kind like additional food in the school, but some of the that will be distributed to the community. This program are already in the national level. We cooperate with the Ministry of Education, and then the facilitator is come from the local government. The appointment of the school by the regency or city in the district level and the selected area, and stunting database in the village. It's also as what we call, it's not the responsibility, but it's a part of the responsibility and care from the school in that village. So if we are talking the lesson learned from this intervention, that sensitive intervention approach is very complex, yeah. And based on that situation, we need to have many innovation, because in the field it's very frequent understanding that in one leaders or one or two village leaders and also the government have a different mission and interest when we are talking the stunting as a common issues in that area. That is the challenge, yeah, about that one. And then the second one, we have implementation of the region required a strong leadership and required a sustainable monitoring and evaluation mechanism. During the COVID situation, we understanding that the mechanism of monitoring and evaluation, it's not adequate, and that's why now we try to have another innovation, how to monitor and also how to evaluate the activities based on our national action plan and also subnational action plan that are already set up in the provincial and also the district level. The third one, the results are not always visible in the near future. It is making difficult when we are talking change the behavior, the parenting, when we are talking one or two cadre are accompanied one or two pregnant women, the result is not in the same time. So talking about that one, we need to more effort to make it the budget administrators such as Bapeda, Bapenas to give a budget, yeah, for the budget allocation for the activities who are not have a result in the near future or not a quick yield, yeah, in the activities. Change in the community behavior and reference to the behavior of the community leader are important factors in the success of the intervention. That is a lesson learned when we are compiled from the all of Indonesia situation. Yeah. The last one I would like to share that even the situation is not 100% very conducive, but based on the it's not basic research survey actually, but the NIHRD, the Ministry of Health, already have data that overall the nutritional status of the children under 5 in Indonesia has improved compared to 2019. Yeah. The prevalence of national stunting as a result integration is 27.7. It is 2% decrease when we compare with the result of the basic health survey, where the highest prevalence is still in East Nusa Tenggara and the lowest prevalence in Bali. Yeah, this is the change situation because at the basic health survey, the lowest province who have a stunting is Jakarta. Yeah, and based on my finding in Central Java, that multi-sectoral approach is needed and regional leadership is very important in mobilizing all potential or resources in the region. Based on the Central Java situation, Now we have 3. In previous, we have 4 medical doctor as a bupati or wali kota, yeah, or the mayor or the leader in the district level. But it's not only talking about the medical doctor itself, but how the leadership, yeah, from the mayor and also the head of the district level, it's very, very important to mobilizing all potential and also resources in the subnational level. That is our presentation today, and now we have a time as a question and answers session. But as what we call the norm of the course, yeah, we have also to discussion session after this presentation that you are maybe will be understanding in all of the aspect, yeah, as I have already shared to you. The discussion talking about the sensitive nutrition intervention that we know have a need to leadership, coordination, and collaboration, as well as consistent of continuous monitoring and evaluation. So maybe in your country, in your subnational level, in your prefecture, in your province, in your district, have experience about that one. How many? So the question is how many sector or ministry are involved and how to make it coordination and collaboration effectively, and who will be as actors, yeah, to monitor and evaluation consistent and continuously. Especially for participants from Indonesia, I would like to discuss with you, or maybe we can also discuss about the good and bad example, yeah, in the special region or district level and others. Yeah. Thank you so much. I will be finish this presentation and give back to you, to Pak Ardian, to make it continue. Thank you. Have a nice day.
Thank you very much, Dr. Anung Sugihantono, for the presentation. I think this is very interesting presentation because we learn about the non or indirect aspect that we have to take into account when we want to reduce the prevalence of stunting. So, and Dr. Anung just already conclude, yeah, right, that if we compare the prevalence of stunting between 2020 and 2019, actually, or sorry, 2018 from Riskasdas and 2019, the prevalence seems likely declined. And this kind of proof of concept that we cannot only execute the specific nutrition intervention, but also sensitive intervention. And that's why also I think based on his thesis that multi-sector collaboration, especially he took the sample from Central Java, where we live now here. Diponegoro University is also part of Central Java, that the multi-sector collaboration is needed to improve the food and nutrition program. So please from audience or from participant, if you have any question, you can raise your hand. Is there any question?
Yeah, if not Pak Adrian, because
Yes.
I also put it my email that in that presentation. So maybe if the participant will be asked something, please feel free to write down in to my email, and then I will be answered during this course or after this course. Yeah.
Yeah. So, Dr. Anung, we are planning because we already have your email, and then we are planning to involve you or to include you to the MKes platform. So we will have further discussion between you, or the interaction between you and participant. There is a participant raise hand, Effie. So Effie Nur Hidayati, please, if you have question.
Okay, thank you very much, Dr. Anung, for the presentation, and thank you very much for the committee. And first of all, I would like to ask two questions, Pak Anung. The first question is related to the behavioral change communication for the community. Yeah, I think in our community, the behavioral change communication is quite challenging. So perhaps based on your experience, as the former of the DG in the Ministry of Health, you can share about the lesson learned on behavioral change communication. And the second question related with the social protection. As we know that in Indonesia also implement CCT or conditional cash transfer. And perhaps you have any lesson learned or any perspective related with the implementation of CCT in Indonesia, and perhaps do you also share your suggestion related with the how to make the CCT can be used specifically for nutrition improvement in the family? Thank you.
Thank you very much, Ms. Effie. I think very nice question to Dr. Anung. Please.
Yeah, thank you, Mbak Evi. According to the two questions, when we are talking about the communication in the field, yeah, as I mentioned before, translate the issue of health into the issue of the social, cultural. It's very important. So when we are talking, for example, yeah, you have to eat an every day, for instance, 10 or 9 gram of the protein. It is very difficult to community understanding about this one. So the translate of the what we call protein into the local knowledge about that one, the sort of the protein in the local who are already understanding and also talking with the others social leaders in the field. It's very important. When I'm visit East Nusa Tenggara at that time, talking about the food and also nutritious food in the Nusa Tenggara, it's not easy because in that area it's very hot, yeah. But they have one of the food who I already know that the food is it's very high what we call some such as the vitamin, antioxidant, and so on that they plant in the surround of the household. We call kelor, yeah. Maybe in Java, kelor is with the different term, yeah. But in the East Nusa Tenggara, kelor is very common, and that is also one of the food that we will change. Talking about the issues of the nutritious food in that area. And yeah, it's not easy. I'm also understanding about that one, Effie, to make it changing about that one. In the macro level, we also have a challenge when we are talking the issue of nutrition. Yeah, talking with the other sector, such as talking with the public work, the Ministry of Public Work. At that time, yeah, very difficult to understanding. But we learned that when we are talking about the issue is not only stunting itself. We are now go to the upstream, talking about the competitive of the resources of the human resources. So at that time I take almost 2 years to make it. Ministry of Public Work will be put at the budget for the house reconstruction and so on. Yeah, according to the CCT, that is a very strategic intervention actually, but we need more to understanding, because talking about the CCT, we have several indicators. Yeah, we only at the time we just only based on the poverty, and the second one we have what we call PKH. PKH is dedicated for the family who have pregnant women or under 5 children. Yeah, that we focus on that. Yeah, so I think how to make CCT more effective and also more efficient to improve the household. We need to integrate it of the information, data information from the village level. As we know that now in the village, almost in all of the village, we already have a facilitator. So I think based on that situation, Ministry of Village and Disadvantaged Area will be as a coordinator. Now the Vice President are already assigned that ministry to coordinate that. It's not Ministry of Social Affairs, as a coordination for that CCT program in the village level. That is our answer, Ibu Evi. But if you have another question, please feel free to chat or to make it email. For me, I will be answered. Pak Adrian, I have another meeting at 4 o'clock.
Yeah.
Unfortunately,
so
ATV. Also talking about the stunting, we will have activity for improving the capacity of local government to tackling the stunting.
So Dr. Anung, unfortunately, he has another meeting with Asian Development Bank. So Dr. Anung, as I said, that I will invite you based on your email to the MKes, and also we are currently still working to put all participants in the MKes stepwise, because the system has to be maintained carefully. So we are still working on that. So we will have another discussion with Dr. Anung within the MKes. Thank you very much, Dr. Anung, for your very nice presentation. We learned a lot from that. So first, maybe I would like to ask for take photography. So could you please just maybe 2 minutes? Okay, we start. Please turn off your camera. Turn on your camera if you you are turning off right now. So I will start. 1, 2, 3. Yeah, 1, 2, 3. And then next one. 1, 2, 3. And the last one. 1, 2, 3. Yeah. Okay, Dr. Anung, thank you very much. Also, from all participants from all the world, thank you very much to join this meeting. We'll see you and stay safe and stay healthy. Bye.
Thank you. Bye. Okay.